Health Alert is brought to you by OU Physicians in Tulsa. Hello, welcome to Health Alert. I'm Pam Butler. Today we're going to talk about hospice care, and joining me from St. Francis Hospice is Sydnie Swallow. Welcome to the program.
Thank you. Glad to be here.
Now, you're a registered nurse.
Yes.
Now, before we start, I do want to throw a curveball at you here for a moment and just tell people in general who might have an interest in becoming a registered nurse, what is the process of becoming a registered nurse? What are the options?
Oh, the options are limitless right now. We're having a nursing shortage, so go to any college and do an aptitude test to see if your personality fits the mode for being a registered nurse. You can go through a two-year program, an associate's degree like Tulsa Community College has. There are four-year programs, Bachelor of Science programs at TU and OU. Wonderful programs. And then if you want to go on and become an advanced practice nurse, the field is just wide open.
And that's really excellent, especially today's economic times, that this healthcare field is definitely where you can have a lucrative profession and a long profession, because there is a shortage and a need.
And a huge variety. It's like if you're in one area and you decide you'd like to do something else, it's a wonderful time.
Okay.
You can explore something else.
Thank you, Sydnie. Now let's look at hospice. Tell our viewers in general, what is hospice? What is the philosophy, the concept of hospice?
Well, we provide end-of-life care. Typically, our patients have failed treatment or have a condition that is life-limiting, typically 6 months or less. Sometimes, that varies a little bit with each patient. But if someone's physician says, "I'm sorry, but you have 3 months or 6 months left to live," I recommend hospice. That's how we get our patients. Our population comes to us through their physician referral.
Okay, so you can't like self-refer.
No, you need a physician, pretty much.
Okay.
We want to make sure that diagnosis is correct and appropriate, and we'll talk. You can call for information, surely, and we can talk to someone and get you referred to someone. But.
Okay, and I will put up information at the end of the program of how to get in touch with St. Francis Hospice.
Yeah.
Let me ask you this, because you talked about 3 to 6 months in terms of having a terminal illness. Does the individual have to be, I know you're working through their physician, but do they have to be at the point where they're incapacitated, where they're not able to care for themselves, or that's really not the case?
No, not at all. Many times people have a lot of plans, a lot of things they want to do, and what we do at hospice is just kind of it's a transition. Whenever someone receives a diagnosis like this, generally it's a shock, so we just kind of ease them through that and say, these are some things you might expect, and you'll talk to Stevie, one of our social workers, that can talk about some of the legal and social aspects of documentation to get in order and whatnot. But no, in fact, I have this philosophy that it's like live every day.
Okay.
I want you to feel as good as you can every day. So as a nurse, my job is to manage their symptoms. And so it's like feel as good as you can every day and be as active as you feel like you can.
Okay.
One of my mottos is, conserve your energy, so that if there's something that's more important for you to do, then save up for it. If you're feeling bad one day, then, rest that day, and then the next day you'll get to have lunch with your family or your friends.
So St. Francis Hospice definitely has a sort of a self-care focus, that you have the patient or the client do as much for themselves as they feel as they can do, with support systems around for the other.
Right. The nurse goes in typically and helps manage the physical symptoms. We have home health aides that come in and provide assistance as it's necessary with personal care, bathing, and changing linens, different things like that. We also have volunteers that will go in if someone is home and a caregiver needs to run errands or something. Then we'll have volunteers that are wonderful people that come in and will sit with the patient while they take care of that. But a lot of our patients drive. Some of our patients still work.
Now then, with the concept of hospice, because people may think that, okay, if you have 3 to 6 months with this terminal illness, that you're in a facility where like a hospital type facility. Maybe it looks a little more homey, but it's a facility nonetheless. But it doesn't sound like that's the case when you're saying they drive and do other kinds of things.
No, the majority of our patients are in their homes, and so we take care of them in the home. It's it's just a different type of care. It's non-acute care in the home. It's like we're available 24 hours a day, so they can pick up the phone and call us, and we'll make a visit if we need to. If it's, you know, something that they need for us to come and make a nurse visit, then we will. So you have access to that, which is really nice. You know, you don't have to wait or go to the emergency room necessarily. You call us and we'll come to your home and take care of you. We have patients in nursing homes. That is their home, and we have, you know, some patients in assisted living facilities. And then we do have in-house palliative care at St. Francis Hospital, which typically their life expectancy is less.
So if the individual gets to the point where they are no longer capable of caring for themselves and do need more of the 24-hour medical or health care, that's when they come into St. Francis.
Well, we try to manage that in the home. We have what we call continuous
care. That as well, okay.
So we'll actually bring people into the home when it gets to that point if they're not able to care for themselves. We do ask that people have a caregiver, because, you know, typically there is a decline in their health and their ability to perform their activities of daily living. So we ask that they have a caregiver that signs up as, you know, if it's a spouse or a friend, neighbors sometimes, or children from.
So if the individual does indeed want to stay in their home until life ceases for them, then they're possibly are quite capable of doing that.
Absolutely.
I mean, in terms of the support system that's there.
That's right.
Now, how do you incorporate then the family members into the person's care, especially if they have children or young children that may be kind of struggling with what's happening? Do you assist with incorporating them into the care for that individual?
Absolutely. They have so many questions. It's like children are so much smarter than we give them credit for, and they need to experience what's going on there, you know, as much as they can. And we have the social workers have a number of different methods that they use, and you can talk to Stevie further about this. We do grief counseling with them. You know, we talk about it. The social workers will do different hands-on projects where I think the focus is not so much on how sick they are right now, but the person, especially if it's a parent or a grandparent, you know, when you remember them as they were and the fun things that you did together before they got sick. So the focus is not just on, you know, how they are right now, but as you remember them and the life experiences that you've had with them. We try to make it friendly, and I always ask, you know, when I'm in taking care of someone, you know, you feel free. If you need to get up in that bed and be with someone, love on them and hug on them,
then that's okay.
Absolutely, absolutely. And we encourage that family closeness and multi-generational, you know, love surround.
Now let me ask another question here in our last few seconds here. In terms of sort of cultural differences, if you have individuals from cultures who have, say, healers or others that they wish to participate, are they able to be incorporated into this care as well?
Yes, yes. We have patients from a variety of cultures in Tulsa, and whatever their beliefs are, that's fine. We'll work with them however we need to.
Okay, and that's really good to know. And then do you keep in contact with the person's physician? Because I'm assuming that St. Francis Hospice has a physician that's going to begin to work with those patients or clients as well. But do you, for some people say, I still want to keep my other doctor. I've had them for years. So do they coordinate that way as well?
They do. Our medical director is Dr. Thomas Costner. He will make an initial visit when someone is admitted into our program. Okay. But we keep, all the orders come through their own physician. Okay. So, yeah, and we stay up to date, you know, whenever we make a change and we need to talk to them about it.
Thank you so much for
joining
us, Sydnie. Please stay with us. We'll be right back.